Hi, everybody. Welcome, and thank you so much for coming tonight. Looks like we have a little echo we're going to fix. Thank you, Cameron. So, how many of you are new to the Neighborhood Health Series? Have any of you is this your first time for anyone? Okay, great. Well, thank you so much for being back with us. Tonight, we have a very interesting topic, and how many of you like going to the dentist? Okay, 3 people. Okay, so. Well, you can probably imagine if you're a child, if you are medically fragile, if you have any kind of intellectual disability, all of the things that make it really difficult to be a patient, to see a dentist. That's what we do here, and that's what I'm really incredibly proud of the work of Dr. Chen and Dr. Gewelber here, who really help to treat those patients that are part of C4K. Who really need specialized dental care because of the things that they're dealing with in their lives. They're not just regular patients. They really are treated especially well, and all of their care is coordinated with their Cure for the Kids physicians here that are treating them. There are not many clinics like this here in Nevada. And just for some of you that may not know, we also have another dental clinic in Henderson, and that is an orthodontic and dental clinic as well. And we have reduced cost care for patients, reduced orthodontia, and that is a wonderful place as well. And we also have our Roseman Medical Group, which is our primary care practice that's over by Spring Valley Hospital. So those are just some of the clinical offerings that we have here at Roseman. So with that, thanks so much for being here. As I mentioned, Clark County Credit Union is our sponsor. You've probably met Craig before. He's not here with us tonight, but without them, we would not be able to provide the food that we do every month. So we're very grateful for everything that they do. We are Zooming tonight with some of our friends in Utah, as well as some other folks that just would prefer to dial in. So hello to everybody on Zoom. We're going to hold questions till the very end, and then I will help to monitor the questions at the end and also the questions that come through in the chat. So with that, love to get started and introduce our very special speaker. Okay. So Dr. Gewelber started at Roseman Dental and Orthodontics in July 2023 as assistant professor in the College of Dental Medicine, teaching residents in the Advanced Education and General Dentistry Residency Program, while also seeing patients at C4K. Originally from Southern California, she started her educational journey in New York City, where she earned a Bachelor of Arts in Sociology from Fordham University and then went on to earn her pre-health professions post-baccalaureate certificate from Cal State University, Fullerton, and then her doctorate in dental surgery, DDS, from University of the Pacific in San Francisco. She then went on to general practice residency at University of Nevada, Las Vegas, and earned her master's in healthcare administration at University of Nevada, Las Vegas. That's a lot of school. So congratulations. Growing up, Dr. Gewelber always knew she wanted to do something in healthcare or education, so she volunteered and explored several options throughout high school with the National Charity League, after college at a local community hospital, and with her family dentist. She eventually applied and was accepted to the University of Pacific Arthur Dungoni School of Dentistry. Fun fact, she is also a legacy there. Her great-grandfather also attended University of Pacific, and he was also a dentist. So really, really neat. After dental school, she decided to complete a general practice residency for advanced education in implants, IV sedation, and hospital dentistry. The residency, originally associated with the University of Nevada, Reno, had exceptional faculty that provided mentorship to pursue a career in education and hospital dentistry. After residency, she joined the faculty at UNLV School of Dental Medicine and set out to build a new course in special care dentistry that included a clinical rotation component for students to experience hands-on care for adults with intellectual and developmental disabilities. She modeled the clinic and course after University of Pacific's program with support and guidance from great leaders in this area, such as Dr. Alan Wong and Dr. Steve Perlman, and then went on to become Nevada's first dental director for the Special Olympics Healthy Athletes program called Special Smiles in 2016. In 2019, she was awarded the Healthy Athletes Volunteer of the Year award. Dr. Gewelber cares very much for animals. This is just another little part of her, and has a small menagerie of pets on her small farm here in Las Vegas. She loves to spend time outdoors with her dogs, do Pilates, and garden. Please join me in welcoming Dr. Gewelber.
Thank you very much. All right. Hello, everybody. Thank you for coming today. Thank you for everybody on Zoom, including a couple of our residents who are joining me. So I hope that this presentation will give everybody some little piece of valuable information that they can take forward with them. When I was in dental school, I learned a few things that I feel like really changed my life. And those are the little pearls of wisdom that I still use on myself today when I don't feel like flossing, and then I really think about it and I'm like, oh no, I need to do that. Like there's like little things that really change the way I look at my own personal oral health care, and then how I look at medical care in general. And so I hope what you get from this is why dentistry and dental care and regular checkups and cleanings are important, and how they affect your whole body and not just your mouth. Your mouth is connected to your body, so that's kind of the overarching theme, that it's not a separate and different thing because it's not part of medical insurance, unfortunately. But it's still important, and I think that you all think it's important too. That's why you're here. So with that, we'll move on. And oh, there we go. Okay. Yep. Thank you to Clark County Credit Union for sponsoring these events. We definitely appreciate food and just general support. So there are a lot of products and pictures and things in here that we do recommend, or recommend something like it. But I have no financial interest or personal relationships with any of the products mentioned, anybody selling the products, etc. Some of it is just things I'll mention. Oh, some of my patients like this product better than this product, but everybody's different, so you kind of just have to test some of them out. I made the outline before I made the presentation. So things might be out of order from this, and also there might be more things than are on this list, so this is an outline-ish. There's a lot of things we're going to touch on, and just to keep things moving, keep everybody focused and engaged, this is going to be a very like skipping stone over the topic of dentistry. It's going to be very superficial and moving quickly. So I hope that everyone's okay with that. It's by design. So in general, we're talking about how your oral health and your systemic health are kind of connected, how your mouth affects your body and how your body affects your mouth. Without getting into too much detail about research methods and research, about research by itself, it is very difficult to solidify a causation or relationship between some oral issues and some systemic issues. So we don't really know 100% the causal relationship between like oral disease and like heart disease, for example, but there are very, very, very strong correlations for some things. And the strongest, most direct relationship we know of is periodontal disease specifically, which is gum disease, and how it affects your whole body in relationship to things like diabetes, heart disease, and some other conditions that we'll talk about. So this slide is, because the research is so strong specifically for periodontal disease, and because I find a lot of patients don't really understand how important periodontal treatment is. People know that generally that their insurance will cover 2 cleanings a year, so they think that they come in twice a year and they're good to go. So it's not quite that simple. I really wish it was, for everybody's sake, but this slide is just showing a little bit of connection, how periodontal disease can, we can use that as kind of a red flag, if you will. Sometimes we see patients with, really advanced periodontal disease, and then we start talking about their systemic health, and they're like, well, I haven't been to a doctor in 15 years because I feel fine. And we'll try and treat the periodontal disease, and it doesn't improve. And we're like, we really need to think about some kind of potential systemic issue that could be contributing to this, causing this, making this resistant to therapy, things like that. So part of periodontal disease treatment is also whole body treatment. So uncontrolled diabetes will cause periodontal disease to be faster progressing, for example, and then also untreated periodontal disease can contribute to it being more difficult to get your diabetes under control. So that's a major relationship. I'm going to go through some other things just briefly, just so we can keep coming back around to any specific subjects later if anyone wants more information. Sleep apnea is one of the conditions that a lot of people have that they don't know. Sometimes they don't know that snoring can actually be a sign of something more serious. Sleep apnea is when you stop breathing in your sleep. It can be because of an obstruction in your airway, like physically your airway is constricted. So like in this example, we look in someone's airway for this is a score to see if you can see the oropharynx, which is this area behind the uvula. The uvula is a little dangly bit that moves in opera singers and cartoons, right? And then I still think about Bugs Bunny cartoons for that one, right? So this is important for two reasons. When someone's airway is very constricted and we can't evaluate their oropharynx, then we can't do a very thorough oral cancer screening, which is one of the things that we're responsible for when we're looking in your mouth. And then also if there is a constriction or an obstruction, that could be the sign of sleep apnea. If you stop breathing when you're sleeping, your oxygen levels go down. It can affect, can cause hypertension, which is high blood pressure. It can lead to memory issues and early onset dementia. I mean, there's other things that it can do. So it's not just a matter of like, oh yeah, I snore a little bit, it's no big deal. We really encourage people to get evaluated. Your primary care doctor, sleep studies nowadays are really easy. Usually you wear something on your wrist or around your waist, you sleep in your own bed at home, it collects data overnight, and then it either transmits it back or you send it back to your doctor. So you don't have to go to a sleep center anymore with all the probes all over your head and sleep in an unfamiliar place, which could distort the information possibly. So I mentioned obstructive sleep apnea. So this person here, these are tonsils. I hope some of these pictures aren't too much for everybody, but you can look away. These tonsils are huge, but the airway itself is pretty open. You can see the tonsils really easily, but that's still kind of an obstruction, could contribute. The other way that there could be an obstruction is when you're sleeping, air is supposed to be able to pass behind the tongue here, and through the nasal cavity into the trachea. If the muscle tension is weak, the tongue could literally block the airway, and the soft palate, which is right here that ends in the uvula, if that's really long for some reason, can block the airway. So there's two ways that you can have sleep apnea: obstructive sleep apnea and then central sleep apnea, which is actually an issue with the nerves in your brain telling your body to breathe. So there's two different reasons why you can have sleep apnea. So it's important to get evaluated and find out exactly which one so you can get the proper treatment. Anyone who knows about a CPAP, it's the machine that you wear on your face and it's loud and annoying. You have to clean it. And a lot of people don't like that. There are a couple of dentist specialists that I know of in town that make sleep appliances that are supposed to be an alternative to the CPAP. I don't know enough about the research to know which one's better or worse, but if one is not working for you, it's definitely worth it to try an alternative. So that's something that you can try. It's an appliance like a night guard, but it helps reposition your jaw to open up your airway, to like position your jaw forward to try and create space behind your tongue while you're sleeping. So a couple other interesting things that, is this in the way? I'm sorry. There we go. We'll hide that. Okay. So a couple other interesting things. This was a new one. I hadn't heard this one recently, that dental cavities might increase the risk of a stroke or a bleed in the brain. This is from the American Heart Association. It's an organization that does look at research and looks at articles that are published for their validity and studies, but there's just more and more articles that come out about trying to connect dots that maybe weren't previously connected. So one of the things that we know about heart disease is and dentistry is there's that like high blood pressure specifically is a silent killer. People who don't know that they have high blood pressure, they feel fine, and then all of a sudden they have a stroke or a heart attack, and all of a sudden they're not fine. People see the dentist usually more often than they see a primary care doctor. And we do take, at least here, we do take people's blood pressure, and we look at the blood pressure right then in that moment, and we look at blood pressure trends over time and try and advise people about the importance of seeking primary care, not just when you have an issue or you're concerned about something, but for prevention. It's always less expensive and better for you long-term to prevent disease and to prevent problems than to react to them. I mentioned diabetes again. Uncontrolled diabetes can have a lot of side effects. We're going to talk a lot about xerostomia. Xerostomia is dry mouth feeling that you have usually from medications or from salivary gland dysfunction. There's lots of reasons, but uncontrolled diabetes can cause xerostomia, a burning sensation in the mouth, delayed wound healing, which is also something that dentists care very much about, because if we are doing some type of surgery in your mouth and your mouth is full of bacteria, it increases your risk for developing a local infection. And I've had one patient that I know of that actually, after a simple filling, this was when I was in dental school. And in dental school, we were trained to check people's blood glucose. If they reported that they had diabetes, we were trained to check their blood glucose at the beginning of every appointment, make sure that they're in a good range to receive care, that they're not going to get hypoglycemic and pass out during the procedure because of the stress and using up, the sugar in their blood or whatnot. I numbed her, did the filling, she went away. She missed her next appointment 2 weeks later, and I called her and I couldn't get a hold of her. I'm like, that's weird. She showed up a month later and said after the appointment, she bit her lip and it got infected, and she was in the hospital for a week on IV antibiotics. And she was mad at me because I didn't warn her not to bite her lip. So I learned that day. Now I warn everybody, no matter where they're numb in their mouth, I warn them. I don't tell them the whole story, but I warn them, and it's that important because something so simple as we bite our cheeks and bite our lips all the time. But if you don't know you have diabetes or you're not under good control, that literally could put you in the hospital. So here we go. Kidney disease, end-stage renal disease, or this is another correlation slide. So adults with end-stage renal disease have more severe oral diseases than the general population. Whether one leads to the other, promotes the other or not is difficult to study, because a lot of times you can't do studies where you withhold life-saving care from one group of people to compare to someone who's receiving that care, if that makes sense. So there's a lot of studies, lots of different systemic diseases where people who have a certain advanced of some type of disease often also have poor oral health. So we're trying to promote good oral health, and hopefully that contributes to people having a general sense of well-being and also being more interested in preventive care systemically and medically also with our physician colleagues. Liver disease is pretty common, and the reason why we want to know about if someone has liver disease is because a lot of the local anesthetics we use are processed in your bloodstream, they go through your kidneys, they go through your liver, and we can select the local anesthetic that is least likely to exacerbate your problem, whether it's kidney disease, lung disease, liver disease specifically, because those are the organs that are most affected by medications that we use on a regular basis for dental treatment. And then liver disease has higher risk for bacterial endocarditis. Bacterial endocarditis is bacteria getting into your bloodstream and settling on usually the mitral valve or one of the valves in your heart and creating an infection that can lead to a blood clot or a stroke or literally damaging the muscles of your heart. Certain antibiotics that a dentist might give you will need to be, I'm sorry. We need to know about these kinds of things so we can give you the right type of antibiotic for certain infections. So an acute infection, acute sinus infection or anything related to the sinus, our go-to antibiotic is called Augmentin, which is this amoxicillin and clavulanic acid combination, which has a higher risk than other medications of causing damage to your liver. So if someone already has liver damage or liver failure and doesn't tell us, and they have a sinus problem and we just go straight to the Augmentin, it could exacerbate that problem or cause a new problem or push you into another stage of disease. Amoxicillin by itself is not as toxic to the liver, and there's like a host of other antibiotics that we can consider. And I don't know all of them off the top of my head, but I know enough to say, okay, hold on a second. We need to consult with your physician. We need to know more details about the exact stage of liver or kidney or lung disease that you have so that we can make a good decision moving forward and make sure that we're safe, that we're treating you safely. Patients with certain stages of liver disease are also put on diuretics, which is similar to what you're put on for high blood pressure. And that can lead to hyposalivation, xerostomia, dry mouth, which is a huge, huge problem in dentistry. For people with liver disease, there's a local anesthetic called articaine, which is mostly broken down in your bloodstream and not specifically in the liver. So that's, again, one of the things that we would change how we treat you to be safer depending on what your medical conditions are and the extent of disease that you have systemically. Bacteria and lung disease, I mean, some of this should make kind of sense. When you have a lot of bacteria in your mouth, if you aspirate saliva, there's bacteria in the saliva and it can get into your lungs and cause pneumonia, cause some type of acute infection. There are naturally, just like your gut bacteria and your gut biome should be balanced and healthy. We have bacteria in our mouth that need to be balanced and healthy, and there's different types of bacteria that cause different types of disease or are correlated with different types of disease. So one of the things we do in dentistry is trying to promote good oral hygiene to try and keep the bad bacteria from growing out of control, overpopulating, taking over where good bacteria should be, and just having the amount of bacteria in the mouth reduced so that if you were to aspirate or you were to have that bacteria travel into your bloodstream, that it's something that your body can handle, that your natural immune system can just take care of that because it's not overwhelmed. I am not going to talk a whole lot about the intellectually and developmentally impaired individuals. That's a really big topic. And a lot of these things that we're talking about is really important for everybody. It doesn't matter, like your age or level of impairment, cognitively or medically, all of these things are important for everybody. It's the general idea of how to have a healthier mouth so that you can be healthier in your body, okay? I put this slide on here after the lung slide because people with dysphasias or difficulty swallowing or muscle control, this can also be people that have had a history of throat cancers or vocal cord disorders or a stroke maybe that would affect the muscle tone in the throat, make it more difficult to swallow. Aspiration is a really common thing. So for children and adults with cerebral palsy, depending on the study, anywhere between 26 and 70% of people are aspirating in a way that leads to some type of infection that needs to be treated medically, antibiotics, hospitalization. Some of the medical conditions that people have, it's like a double-edged sword. So with cerebral palsy specifically, some medications will increase drooling and increase saliva production, but that will increase the likelihood of aspirating. And especially when you can't swallow well and you have more saliva and things going on in your mouth. So then you're also given a medication to help reduce saliva. So now you're taking more medications, and then the lack of saliva can cause problems in other ways. Two things that are extremely well researched are the relationship between cigarettes and cancer. I'm sure everybody here was around in the 90s. We've got all those commercials that are still like burned into my brain, not related to cancer, but the egg on the frying pan, right? Like we all remember that one, I hope. And so smoking, tobacco use is just terrible for your risk factor, just your risk of developing some type of oral or oropharyngeal cancers. What's interesting is that alcohol and cigarettes in combination, they're more than the sum of their parts. So if you smoke and drink excessively, your risk is just through the roof compared to someone who just smokes or just drinks or doesn't do either. People who smoke, how it affects your mouth too, it actually causes the blood vessels in your mouth to shrink and the tissue in your mouth, the gums, to get really fibrous, which is really like dense. So you have less bleeding in your gums, so you think you're more healthy. But there's actually more bone destruction and it's called periodontitis, which is the loss of bone around the gums that occurs, but the gums will still look as tall as they were and look healthy just by like on the surface. So it can mask a worse problem. A really great topic recently that we have been talking about in the state, trying to even change state laws to allow dentists to start vaccinating people for HPV, for the human papillomavirus, to try and prevent oropharyngeal cancers, because the relationship between HPV and oropharyngeal cancer specifically is so strong. So certain types of HPV viruses are found in up to 90, is it 90%, Dr. Chen? Yeah. 90% of oropharyngeal cancers have HPV virus in those lesions. HPV is something that vaccine's been around for a long time, but it was only approved for like up to age 26, and it was really pushed towards women to prevent cervical cancer specifically. Oropharyngeal cancers numbers were climbing, and mainly in young men. And when they finally discovered the link, they started promoting the vaccine for men as well. And it's still a cultural thing because people still think of this as being a cervical cancer issue and not, and also people don't want to talk about STIs, and they don't want to talk about it with their children who are 9 and 11 years old when the vaccine is recommended. So it's one of these things we're trying to normalize the conversation, and we're going to talk, and as us as dentists, like, of course we want to prevent cervical cancer, but I really want to prevent oropharyngeal cancer because oropharyngeal cancer is very difficult to treat. It's often found in later stages, and often when there's not a lot of options, and the options are not great. So the vaccine is safe. It's very effective. It can literally prevent something that could kill somebody, and it's really pretty easy. So the younger you are, sometimes it's only 2 shots, and then for older people, it can be 3 shots. And now it's been approved for people up to the age of 45, 46, 45? Like, you don't know. Okay, sorry. I think it's in their 40s. It doesn't protect you from anything you're already exposed to. So the older you are, the more likely you've been exposed to different strains of HPV. It's potentially going to have less benefit. So that's something you have to talk to your primary care doctor about. But if it has a chance, then and the risks are outweighed by that benefit, that expected benefit, then I strongly recommend it for everybody. Definitely for young people, teens, if they haven't had it. So other risk factors, being overweight, usually risks for some of these things increase with age. HPV-linked cancers do tend to be diagnosed in people younger than 50. So we want to try and prevent that and just make that not even a thing. Ultraviolet light, so we would see potential skin cancers developing on the lips. As a dentist, when I'm looking at someone for the first time, I do look at their face and their skin. I'm not a dermatologist, but we will ask about or suggest or say, like, do you have a dermatologist? Have you seen a dermatologist? Because we want you to get screened and do some prevention in other areas too. Poor nutrition and then certain genetic syndromes will predispose people to cancers. Radiation chemotherapy. So these are going to give you a little bit more gory pictures, but part of it is really important. If you can prevent this really easily, like with a vaccine, or if you can help someone that you love who's eligible for these vaccines get them, then hopefully we can just have fewer people have to suffer through these types of things. Mucositis is not something specific for oropharyngeal cancers. Radiation chemotherapy cause a mucositis. It's just sores in the mouth, like canker sores, but just all over and really intense. Thrush or candidiasis is something that can occur in anybody that's immune compromised. This is could be patients that are suffering from AIDS, patients that have taken a lot of antibiotics, patients that just have a suppressed immune system for something other than radiation chemotherapy. Xerostomia is the dry mouth that I have a whole slide on that. We'll talk about that. It's really important. The xerostomia is what typically leads to the dental caries, which is cavities on the teeth. Trismus is soreness in the jaw and limited opening and not being able to open your mouth. Delayed healing, that goes along with it being immune compromised. And then osteonecrosis of the jaw is an interesting one. When there's been radiation, certain amounts of radiation to the head and neck, the bone actually heals so poorly that it can actually just necrose, and you get little patches of bone that die off and start to slough off, and sometimes it needs surgery. Most chemotherapy patients will experience this mucositis situation. Almost all of transplant patients will experience it, and pretty much 100% of radiation patients with any radiation to the head and neck. So that's why prevention and early diagnosis and early treatment is so important. Depending on the level of mucositis, some people get to the point where they can't eat at all, and it's just absolutely life-altering. Luckily, it is temporary. It is something that typically resolves with supportive therapy, either in or out of the hospital. Since it's Halloween, I thought I'd just throw in something else really bad. Just kidding. I'm not gonna do that. So the surgeries for oropharyngeal cancers can be quite intense, and hopefully nobody here ever has to experience that. But there are a lot of really amazing skilled surgeons that treat patients like this. I have several friends who are survivors of throat cancers, different stages of the type of surgery that they had to have, and you can recover and you can survive, but we want to prevent it and we want to catch it early, which is really difficult to do. So xerostomia in itself can cause a lot of problems for a lot of people. It can increase your cavity risk, which is the main thing. It increases the profoundness of periodontal disease because it dries out the tissue, and there's no lubrication. So you can have a lot of, if you wear dentures or have some type of removable appliance, it's gonna rub on the gums and on the tongue and on the cheeks more and cause more sores. So the lack of lubrication, so there's more friction with everything in the mouth. It can hurt. There can be literally, your tongue might burn with a lack of saliva. Saliva has enzymes and antibacterial properties to some extent that help keep your teeth clean and help keep things healthy. It can make it difficult to swallow, which can increase your risk for aspiration or choking or other food impaction issues. And it reduces quality of life. So I mentioned antibiotics a little bit before, and like what antibiotics are for what. So there's a whole guideline from the American Heart or heart organizations and also orthopedic organizations talking about the importance of taking antibiotics before dental procedures to prevent the risk of bacteria from the mouth during gum manipulation with a cleaning or a gum exam getting into the bloodstream and somehow causing an infection or of a prosthetic joint or of endocarditis, which is of the heart. So the guidelines change all the time. Some people here might have had a joint replacement and been told you have to take the antibiotics for life for dental procedures. Then for a while it was, oh, it's only for 2 years after the surgery. And then it was, oh, it's 5 years, and it depends on if you have diabetes or other conditions. And then it was like, oh no, we don't do that anymore. So the ultimate decision should be made with the orthopedic surgeon in discussion with all of your other risk factors. So joints are more likely to fail if you're really overweight because there's literally more pressure on that joint. Joints are more likely to fail if you've ever had a history of failure or skin infection that would contribute to bacteria getting into that space. And the idea is it's a risk and benefit discussion. So the risk of taking 1 dose of antibiotic twice a year before your dental cleanings kind of outweighs the risk of having your joint fail and then being in the hospital and on IV antibiotics and in a wheelchair and potentially not walking again. So that's kind of one of the ways people made that decision. It's also really difficult to really pinpoint if someone has a joint failure and they happen to have their teeth cleaned 2 weeks prior, they're going to blame the dentist because they need to blame somebody. So there's a little bit of a legal thing there where sometimes we do think, I don't want to say sometimes people will make that decision to pre-medicate their patient because they think it's going to stop them from being to blame for something that may or may not happen and they may or not have anything to do with. So it really should be up to your orthopedic surgeon to have that conversation with you and talk about your personal risk factors, the risks and benefits of that, and then we'll help explain the risks of what the procedures we're doing are. Some procedures should be pre-medicated if you're at risk for these infections, and some really don't need to be because the likelihood of bacteria getting into your bloodstream is no worse than when you brush your teeth at home. So you're not taking antibiotics every day when you brush your teeth, so you shouldn't have to take antibiotics every time you go to the dentist. Infective endocarditis is, I mentioned that bacteria gets into your bloodstream, it collects around the valves here, and it can either collect and turn into a clot that travels through your body and goes to your lung or your brain and causes a stroke, or it can degrade the valve itself and require open heart surgery to replace or repair the valve. So there are more indications for antibiotics for heart issues than there are for joint issues, and this is some of them. A prosthetic cardiac valve, so if you have had a valve replaced with a prosthetic material, that should be pre-medicated before invasive dental procedures. If you've had a history of infective endocarditis, that's usually a good one because it's like you've already been through that, you don't want to go through it again. Certain unrepaired conditions. So we have the American Heart Association has a list. The American Dental Association has a list. If you're interested in reading through some of that to see if you might qualify for this, you should definitely have a conversation with your cardiologist, your orthopedic surgeon, and/or your dentist. Prophylactic antibiotics are also indicated for certain people going through different stages of cancer during active chemotherapy. If someone especially has a central line, which is a port that's implanted and goes directly into the heart or near the heart, that's a good one to pre-medicate, and usually their immune system is compromised at that point as well because they're receiving active chemotherapy medications. We should always be consulting with their oncologist, with their treating physician, because there's just so many variables on how the patient's going to react, what medications they can have. If they're taking lots of medications, there's drug interactions that we're not always experts on, which leads to medical consultations. This slide is all words. I was advised to change it and I didn't. So it's just, I'll just go fast. So basically for medical consultation, it's a communication between me and the medical professional about you to make sure that we treat you safely. It's not intended to delay your treatment or make you upset or waste your time. It really is intended to get information we need so that we can treat you safely, even if it doesn't feel that way sometimes. We're informing the physician or the treating doctor about your oral conditions and what treatment we're recommending, how many appointments it's going to take, what kind of local anesthetics we're going to use, if we're going to do, if there's risks for bleeding or anxiety or pain, because if there's pain, we want to treat your pain. But if you're already taking 3 narcotic medications from, chronic pain specialist, we're not going to give you more pain medication. But we need to inform somebody like, hey, this is happening. This is going to change how they respond to your therapies potentially. We need to know what kind of local anesthetics we can use and how much local anesthetics. So people with kidney disease, they're going to filter those local anesthetics out of their bloodstream slower. So we don't want to use so much that we overwhelm you and give you some type of toxicity. Based on age and weight is a big thing too. So for children or for adults that are underweight for whatever reason, we have to consider those types of things as well. We're going to ask about your medical history so that we can make modifications to how we treat you to help you. Patients that are on dialysis, depending on the dialysis, they may or may not be at higher risk for infections, in which case we're going to do the antibiotic prophylaxis, and also we're going to do dental treatment on off days, not on dialysis days. So depending on diabetes and other things, we're going to do treatment in the morning and not in the afternoon, because that's when they're under the best control, or that's when it's closer to when they took their medication. There's all kinds of reasons why we really want you to fill out your medical history form and not just swipe no all the way down the page and not read the questions, because then we can miss something that might actually make a difference. So I put this on as an example because blood pressure is something that we see all the time. I saw somebody today and their blood pressure was, I couldn't believe they were still walking. I'm like, are you sure you feel okay? Like, you really need to go to the emergency room. I really am concerned about you. But for someone that we just notice that they have high blood pressure and they say, oh no, it's always like that. I feel fine. It's only when I come here. We hear these things all the time. I'm gonna inform the doctor about why I saw this person, why I checked the blood pressure, what the blood pressure was. I explained to them what our rules are. So for dental treatment, there are rules about if we can or should treat you for dental procedures. And that is for elective treatment, the rule is 160 over 100. Even for urgent dental treatment, for what you would think is an emergency with pain or something broken, there's a limit, and it's not safe for us to. It may not be safe for us to continue with dental treatment when you have this other outstanding issue going on, because untreated hypertension, high blood pressure, is called the silent killer for a reason. It sneaks up out of nowhere and it can take you out in just a second. I know I had one of my best friends from dental school actually died of a massive heart attack out of the blue at age 45. And I don't know if it was related to blood pressure, but some people think that they're invincible. I feel fine, so I must be fine. And we see that in dentistry as well. Oh, well, it doesn't hurt, so it must be okay. Well, not everything in dentistry hurts. when it's easy to fix. Once it starts hurting, now it's a whole big ordeal. That's why root canal treatment gets such a bad rap, because you waited till it hurted maybe to seek care, but you know, that's a whole thing. One thing we deal with a lot is medication non-adherence, and this is I'm guilty of this. I can't even take vitamins every day reliably. So I'm really fortunate right now that I'm not on any prescription medications, but not taking medications as directed can cause a lot of problems. Not taking antibiotics. So in dentistry, one of the very, very common things is antibiotics that are prescribed. If we prescribe you an antibiotic for 7 days, you're supposed to take it as directed for the full 7 days. Stopping antibiotics early, just because you feel better or because you don't think it's helping or whatever, can lead to the formation of antibiotic resistant bacteria. And that means that the infection comes back bigger and worse. And now it's not responding to the antibiotic. So now you get a different antibiotic, and maybe that one is worse for your kidney and then the other one. And it's like a whole big snowball effect. There are antibiotic resistant issues, like problems all over the place, including there's one drug that's really common for oral candida or fungal infections in the mouth. And everything's resistant to that now, but people still use it because that's what you use. And then it doesn't work. And then they see an oral pathologist and then they're like, and then they're told, oh, that doesn't work because too many people use it and abuse it. So anyway, we want to try and there's something called antibiotic stewardship that we're supposed to do. So we're not going to give you antibiotics just for everything. Lots of people come in and they ask for antibiotics. Or I say, oh, well, you have an infection, so we need to do root canal treatment. They're like, well, just give me antibiotics instead. That's for infections. Local infection with the source of the infection has to be treated properly. Systemic antibiotics that go through your whole body and affect your gut and your mouth and all of kinds of things can cause other problems. So we should be very diligent about who and when we give antibiotics and how much and what kind and all those kinds of things. We get people sometimes are like, oh, I went to the dentist, they gave me antibiotics, so the problem went away, and now it's 6 months later, and now I can't fix the tooth, but maybe 6 months before I could have, but it didn't hurt. So these are kind of like the themes that we see a lot that I'm hoping that make sense so that nobody in this room is ever guilty of doing that when they finally come see us. So specifically, medication non-adherence. High blood pressure medication is a big one. Antibiotics is a big one where people don't do it right. High blood pressure medication is another one. It often will take a few months before you start to feel better once you start taking medication for high blood pressure. It is not like pain medication. You don't just take the pill and magically your blood pressure is down at a normal level. It has to build up in your system and it has to be taken regularly, like kind of on the clock to keep you at a lower pressure. Now, when you're used to operating at really high blood pressure, and now all of a sudden you're being forced into this low blood pressure area, you're going to feel tired, weak, sluggish. You just don't feel good. And it makes you not want to take the medication. And now your blood pressure is doing this. And then, or you come to our office and your blood pressure is through the roof. And oh, I forgot to take my medication today. And I'm like, I think you forgot to take it all week. Or I don't know why it's so high. I took it this morning. Well, it's not like pain medication. It doesn't work like that. So you're not taking it consistently. It's not going to work. And then we're going to have to keep rescheduling you. And for a patient perspective, it's inconvenient. I had to drive across town. I took a day off work. You know, it's annoying for the patient. I mean, I don't have to worry about it here, luckily, because this is a nonprofit clinic and we're here to help the community and it's low cost for everybody all the time. But if you're seeing a private office and your dentist is not going to like that they scheduled you for an hour and they made no money off of you or your insurance. Okay. So there's a little bit, it can get frustrating, especially if it's a repeat, like continuous thing. We're going to send you back to your physician and hopefully they will go over with you why it's important that you are being compliant with your medication so that we can keep your heart healthy so that you can come in and get your necessary dental treatment. So that's a big one. I thought this was interesting, that's why I put it on here. Studies found that younger patients tend to be more non-adherent compared to older patients. So I don't know, I don't know why that would be, but I think that's interesting. I guess I'm guilty, but yeah. Women were consistently found to be more non-adherent than men. I thought that was interesting too. Both of those things are complete opposite of what I would expect. I would expect older men to be the worst at this, but apparently not. So I don't know. Other things like this, minority groups tend to experience a higher level of prescription non-adherence compared to white patients. And that can probably go along with just understanding health literacy if there's a cultural barrier there or I don't know, it's really unfortunate. So it's good that people are studying this kind of thing so we can get resources and information to the right audience that needs it the most. So I think that's great. And then, oh, here's another one this is another big one, anticoagulant therapy. I don't know if anybody in here is taking anticoagulant therapy. I have an acquaintance in Pahrump who just called me to complain that their dentist wouldn't let him get his teeth cleaned until he stops taking his Plavix for 7 days. And I said, please, 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 please do not stop taking your Plavix, get a new dentist. Because the likelihood of having a stroke from discontinuing your anticoagulant medication is very, very high compared to the likelihood of bleeding to death from getting your teeth cleaned. In fact, it's probably never happened. It's not a thing. It doesn't happen. If you're bleeding so badly from your gums, it should be hemorrhaging just by standing here looking at you. That's when I would probably not want to clean your teeth. But if you have had a stroke, if you have atrial fibrillation and you need anticoagulant therapy, I also want you to get your teeth cleaned and we can handle it. It'll be fine. When I was a resident, and I don't remember all the details, when I was a resident in my GPR, one of the very first patients I saw missed their appointment. It was supposed to, I didn't see her. I saw her, but not on that first appointment. I had this patient, she was on the schedule for an emergency, had a toothache, wanted an extraction, no showed to the appointment. And I'm like, well, she's in that much pain, why didn't she come to her appointment? That's irritating, right? So she shows up in 2 weeks and she's just like, I'm dying, I'm in so much pain, you got to get this tooth out. I'm like, well, why'd you miss your last appointment? Oh, my neighbor told me I had to stop taking my blood thinners or you wouldn't see me. Is your neighbor a cardiologist? Like what do you mean? And we didn't see her. We sent her to the emergency room because everything that led her to needing anticoagulant therapy and getting to the dental office 2 weeks later, it was too much. So she was very upset that we weren't going to take her tooth out at that moment. We sent her to the emergency room. I hope she got the help she needed, but that's just not a thing. And you're not going to bleed to death from even a single tooth extraction. We've got all kinds of things we can do in the office to mitigate excessive bleeding. And if we can't, we can stabilize you until the paramedics arrive and get you the care you need in the hospital. Stinks calling 911, but if it's necessary to save your life or if it's a false alarm, whatever, we're going to do it because we want to make sure that you're safe. So these studies were about basically if you stop taking anticoagulant therapy and then you end up in the hospital, you're more likely to not make it. So I realized that I'm getting close to like the 1 hour that I was given, and I'm gonna speed up, but that was like the medical stuff, and now this is like dental stuff. So I'm gonna go fast, and I hope that it's not too fast. I could talk all day about this stuff. That's why it was really hard to put everything together into 1 hour. Gum disease, okay? Gingivitis is inflammation of the gums. It looks like this when you don't brush your teeth and your gums are just red and puffy and upset because there's plaque and bacteria all stuck to the surface right at the gum line. On an x-ray, when we take x-rays, and that's another thing, like when people say like, oh, I don't need x-rays, I got them 2 years ago. Well, x-rays are really important for us to see in places that we can't see with our eyeballs. And the amount of radiation that you're receiving from x-rays nowadays with digital is so small that you're getting more radiation from eating a banana or walking across the parking lot than you're getting from a couple of pictures that we want to take. So I hope that there aren't dentists out there over-radiating patients, but it's really hard to over-radiate somebody for an annual checkup. Now, some offices are recommending x-rays every 6 months. Some are recommending them every 2 years. in general, the reason why they would recommend it more or less should be based on your personal risk factors. If you're developing cavities and you have a cavity every time you go to the dentist, they're going to take x-rays more often because they need to catch them while they're small, catch them while they're early, and try and help prevent them. If you've never had a cavity in your life and your saliva is healthy, you're not taking prescription medications, you could theoretically go up to 18 months. 18 months is kind of the general rule. Like that's when we might be neglecting something. So there's that. So in this x-ray, there's no bone loss. Just take my word for it. The level of bone is appropriate for that person. Periodontitis is where you start to, that whole saying, you're looking long in the teeth, right? As saying about getting older, because the older you are, the more likely you've had periodontal disease develop or come and go in waves. And then the bone levels go farther away. So even if it looks okay, like, oh yeah, these gums look like pretty, there's a little recession, but they look pretty healthy. And then you look in here and the bone level is so far down that now you've got spaces underneath the tooth. The difference is bone loss or no bone loss. Periodontitis, which is the destruction of the bone supporting the teeth, is always preceded by gingivitis. The bleeding and inflammation of the gums always comes first. So if we can keep you like this, or not, if we can keep you from developing this and the inflammation, just by giving you the better tools and products you need to clean your mouth every day, we can prevent that for the most part. When your hygienist is stabbing you in the gums and telling all these numbers, 323, 323, 422, all of that, they're measuring the space between the gum and the tooth. A healthy tooth, the space is very small. In gingivitis, it's still a small space, but you're bleeding. And in periodontitis, that probe will just sink right in there. So your gums could look healthy, it's at the same level, but there's a big gap there for bacteria to collect. I'll skip some of this. Some of this is, you don't need to know the details, but basically when someone says you need a deep cleaning, it's because you've got bone loss and they have to get down really deep to clean the roots of the mouth, the roots of your teeth. If there's bone loss and recession, the roots are exposed. The enamel, the white part of your tooth, is glass smooth and it's really smooth, right? Like you can scrape your teeth and it's nice and glass smooth. That's really easy to clean. If there's tartar or anything stuck to that, it just comes right off. It's right on the surface, very easy. Underneath the gum, if the roots are normally attached to bone. So the root is kind of porous, it's kind of rough, because bone has to be able to like get in there. So once that area is exposed, now you've got all these little like micro cavities where bacteria can collect. And at that point, a toothbrush and floss are just not going to cut it. So that's why we need all these extra little instruments, and the hygienist will get you numb because they don't want to be scraping underneath your gums and hurting you. If you refuse local anesthetic for a deep cleaning, like a legitimate deep cleaning, they're not going to do a good job. They don't want to hurt you. So they're going to be more gentle, in which case they're not going to do a good job. And then you're not going to heal. So it's really important that they do a good job. That requires being numb for many people. And then I didn't make another slide for this. After a deep cleaning, we do a reevaluation to see if you healed. Some spots might not have healed, and it needs to be done again in that spot. Just focus on that spot until it heals. If it doesn't heal, we send you to a specialist, and then, you know, that's a whole thing. 3-month cleanings is rooted in science. It takes about 12 weeks after you have a professional cleaning with a hygienist before it knocks down that disease inflammation state and the process that's destroying the bone around the teeth. It takes about 12 weeks for that process to start up again. So if you have a regular cleaning with a hygienist every 3 months, you can keep that under better control than if you're just doing the twice a year or once a year that your insurance will pay for. So even if your insurance doesn't pay for it, it's strongly recommended that you do what you call interval that we suggest. And depending on my mood, I remind people that their insurance will cover dentures, but you don't want that either. So, I mean, so sometimes it covers things that you do want, sometimes it doesn't cover things that you need. So that's just unfortunately the nature of insurance. This is a product, just to go back to, if you do have a loved one, or if there's an issue with a patient not being able to do good home care and not being able to do good plaque control and removing bacteria from their mouth on a regular basis, POV1 is an iodine product that is specifically made for intraoral use, and it kills bacteria and also prevents plaque from growing back for a period of time. It actually affects your saliva and affects the bacteria in a way that helps reduce the amount of plaque accumulation. So if someone is resistant to help, so oftentimes with small children or with people that have some type of intellectual or developmental disability where you can't really get in there and they're not going to be able to do a good job on themselves, that's something we can do. What we would do is we would apply it one time to show a caregiver how to do it, and then they get 5 more ampules that they can do at home once a month, and it's going to help with oral health. Dental caries. Okay, so bacteria in the mouth, specifically this one type, is usually associated with tooth decay. Bacteria and food collect on the teeth, and that forms plaque. Okay, plaque is a biofilm, which is this whole collection, and the bacteria actually produce chemicals and mucus layer that helps it stick better to the tooth because it wants to be there. It likes the food you're eating. It wants to stick to the tooth. Bacteria produce acid as a byproduct of their metabolism. So when the bacteria eat the food that you're eating and it's stuck to the tooth, it's creating a little tiny spot of acid where it's eroding the surface of the tooth. As the surface of the tooth breaks down, it creates a cavity, which is a hole in the tooth. When the hole gets infected with the bacteria, that's decay. Okay, so this is like the root in the hole in the ground and like the whole thing. So that's I'm so out of time that I have to go really fast, but we can talk about this one-on-one at some point too. Dental caries has all kinds of different, it goes from like nothing to have to take the tooth out. We like to catch it early on. Maybe we can do some prevention here when it's like a 1 or a 2. We do so, or here we're going to do a small filling. This is going to be a bigger filling. This may be a root canal, and this is an extraction. So it doesn't usually hurt until it gets to here. Now it's already too late just to do a simple filling. Okay. This is what cavities look like on an X-ray. These are not the same person, but these cavities, these black spots here in between these teeth might not be visible just looking with a mirror. That's why we have to take X-rays. So we can see this. This is already huge. It's already too late for just a simple filling. But this we could do fillings on. Caries risk assessment is just something that you can Google if you want to try and find some of this. But basically, there's protective factors like healthy saliva, water, clean teeth, fluoride. And then there's unhealthy factors, and it's a teeter-totter, but it's a lot easier to damage your teeth than it is to fix your teeth, right? So that's why the fulcrum is not centered, because it's not a perfect balance of healthy and not healthy things that you can do. It takes a lot of effort to help protect your teeth, and it's so easy to watch them get damaged. Here's a product, Silver Diamond Fluoride. I absolutely love this. These are on children, children who are maybe too small to cooperate with traditional dental care like fillings. This is a chemical we can easily place on the tooth. It will temporarily arrest the cavity to an extent and just buy time until either the child can cooperate because they've now become an age where you can work with them, or until the tooth naturally exfoliates. I use this on myself to prevent. So it's not just to treat cavities that already exist. It actually can help prevent cavities. It's great for people with a lot of recession and xerostomia that are at risk for root cavities down on the roots of the teeth, maybe below the gum line, because they're so difficult to access. And certain filling materials don't stick to the root as well as they do. So no filling lasts forever. This is just a great preventive tool. I love it. I give it to everybody. There's good things and bad things about it. These types of things on the gums, so the recession right at the gum line, when there's not bone loss in between the teeth and there's only bone loss like right at the gum line, that's usually related to your bite. It has nothing to do with you brushing too hard. You're not brushing too hard. That doesn't happen. It's an old thing before we really understood like the mechanics of the teeth hitting each other over and over and over your lifetime. This recession, we'll just skip this part. We'll talk about it. You can even ask about it. People come in sometimes if they have a missing tooth. Now their bottom tooth is drifted and it's hitting the roof of the mouth. They come in and they want an implant or a partial denture to fill a space. And it's like, there is no space. So now we're talking about orthodontics. Do lots of orthodontics for adults. It's not generally too late to try and improve things. And at Roseman University, we do have an orthodontic program. So we are doing Invisalign and traditional braces for adults. If you've got crowding, if it's bothering you, it can also affect your gum health. And because I'm out of time, I'm just gonna leave it at that. Are we okay? I'm sorry. This is like people have burning questions. I'll stay late. It'll be fine. Okay. Acid is something that I mentioned briefly about how it affects, how it can start cavities, how you can like develop cavities because of localized little bits of acid on your teeth from the bacteria. Acid can lead to this is called attrition, and there's also erosion. Attrition is the physical damage of missing enamel and dentin from the teeth physically touching. Erosion is a chemical process. Erosion leads to these holes, these pits in the teeth that aren't necessarily decay, and it leads to thinning of the enamel, which will make your tooth look more yellow. So lots of people start whitening, which is peroxide, which is acidic, which is going to progressively make the erosion worse. So depending on why your teeth are getting yellow, it really could be you already had too much acid in your lifetime, so you need to please stop, or surface stain that needs to be out. So it's a good idea to ask first before you start doing things. Just because it's over the counter and it's available on Instagram doesn't mean it's safe or effective or good for you or whatever, okay? So enamel dissolves around 5.5. Dentin dissolves as high as 6.7. Neutral is 7. Healthy saliva is about 7. Tap water is about 7. So you're really not far. Once dentin is exposed, once you lose the enamel and the dentin inside the tooth is exposed, it's eroding, okay? So we've got intrinsic acids, which is your own stomach acid, which is down here at 1, from GERD, acid reflux, vomiting, burping. If you have, that's why if you have any kind of signs and you are diagnosed with acid reflux, like it is affecting your mouth, if that's important. Extrinsic acids, coffee, tea, wine, juice, soda, tomato sauces, they all live here, right above stomach acid and below dentin dissolving. And then, of course, the traditional one, people say, oh, cavities are caused by bacteria. Yeah, well, sugar, carbohydrates, the things that you're feeding the bacteria produce acid. So that's where that comes from. So we want to try and avoid things that are in your mouth for a long period of time. So because time is a protective factor, you want your teeth to be the teeter-totter. There's demineralization where minerals are getting pulled out of your teeth, and remineralization where we're putting stuff back onto the teeth to try and protect the surface of the tooth, okay? So we want to try and limit how much time our mouth is exposed to the bacteria, acid, sugar, all that kind of stuff. So we want to avoid hard candies, suckers, caramel, dried fruit, fruit leather. I grew up in a time where that was supposed to be a healthy snack. It's not healthy. It's not good for you. Not good for your teeth. It might be healthy for your body in some way, but there's a lot of sugar. It's concentrated sugar. It's not good for your teeth. Anything that sticks to the teeth, and then of course things that are naturally acidic. So citrus and like citric acid. If it's got citric acid in it, it's not good for your teeth, even though it tastes good. Popcorn is like a huge risk of fracturing even a healthy tooth. Even the healthiest tooth can break if you hit it just right with the right thing. Popcorn kernels are, unpopped popcorn kernels are a huge, I would say just of all the people that I have talked to in the last 3 years that have broken teeth, easily 50% were popcorn. I mean, it's that. And then we had a dental office sent us a popcorn basket recently, and I was like, I'm like, you should know better. And I ate the popcorn, and I'm like, I eat really slowly. Anyway. There are sugar-free alternatives to some of these things that we like. So like I like these Dr. John's tropical fruit hard candies. They remind me of Jolly Ranchers just enough that I don't necessarily miss Jolly Ranchers. They're not quite as good as Jolly Ranchers. Xylitol is toxic to pets, including cats and dogs. So when I start talking to people about xylitol products, you just have to really make sure your animals don't get into it. It can make, some people are more sensitive to it. It can make your stomach upset. It doesn't hurt me. I can eat a whole bag of these in like 5 minutes and I'm fine. So, and then some products, even though they're meant for dry mouth, are still acidic. So some dry mouth products, now there's that whole risk benefit thing. So you feel moist and you feel lubricated, but now your teeth are in trouble. So we gotta like try and find products that do better things. We wanna focus on the time again, so I'll skip through this, but the main thing is a can of soda consumed in 5 minutes, just over and done, is better for your teeth than a can of soda sipped over an hour. It's not about the amount of sugar necessarily, it's about the amount of time that your teeth are exposed to the sugar. Okay. Alkaline water might help. Rinsing with baking soda and water will help boost the pH in your mouth quickly and neutralize acid that might be in your mouth, so it's good to keep around. Denture care, just quick tips. Anybody here that knows somebody that's wearing dentures, don't use toothpaste on your denture. It's too rough. It's going to scratch the surface. You're going to grow more bacteria. It's going to be harder to clean, can get infections on your gums. Okay. Adhesive is nothing to be ashamed about. Adhesive will improve the fit of your denture. Even if you have a perfectly fitting denture, it will help prevent some food from getting underneath it. It's just a pain in the butt to clean. There's all kinds of different denture adhesives. Everybody has different preferences. I know some people, they like the Civon, which is like a piece of paper that gets stuck in there. Some people don't mind the paste. Some people like the powder. It's really a personal preference thing. Denture care, you want to use the denture brush that came with it, or just a soft brush, liquid hand soap or water, and then soak it in the tablets according to their instructions. Some are overnight, some are for 5 minutes. Rinse with water, don't over soak. Never soak a denture or anything made out of acrylic like a retainer in Listerine, chlorhexidine, or anything. I did that. My retainer in college, I soaked it in Listerine overnight and I threw it out after that. So it was bad. Don't do it. Cleaning teeth that hold partial dentures. So partial dentures are relying on a couple teeth in the mouth to support them. Those teeth are at very high risk for getting new cavities and also getting torqued. If the denture is not fitting right, it's going to put a lot of pressure on that, increase mobility. If you get a cavity on a tooth that's holding your partial and then that tooth needs treatment or needs to come out, the partial doesn't fit anymore. So it is also very normal. If anybody here is going to have a denture someday, it's completely normal to be biting your cheek and tongue and speaking weird for a little while. It is a prosthetic device. You have to get used to it. You have to have a little bit of willpower. You have to push through the problems. Cheek biting and tongue biting are completely normal. Dentures are a traditional denture with no implant support is not like natural teeth. It is not the same. You cannot eat the same things that you were going to eat. Even the best denture on the planet maybe will get you about 40% function back. Instead of chewing around like and grinding like you do with natural teeth, you have to learn how to chew either straight up and down and basically crush the food, or you have to have soft enough food and balance evenly. Lots of people eat on one side or the other, and they're used to just chewing on one side or the other. You got to eat on both sides. So it's a whole new way of like learning how to do things. Some people transition and tolerate it very well, and some people don't, but I think it's because they have poor expectations, okay? Expectations are important. Got to set reasonable expectations and also know what the person wants so you can recommend the right treatment. If you know somebody's not going to tolerate a traditional denture, we have to give them a pathway to something that they will tolerate, and that's unfortunately more expensive implant supported prosthetics. We have ClinPro. It is a prescription fluoride toothpaste that I absolutely love and I use for myself. There's all kinds of other options. Prevident is another big brand that a lot of pharmacies carry. Similar, not the same. Sensitive toothpastes are not all the same. There's different types of ingredients that are for different things. So again, we should, if you have questions about different products and why one's better than another, it's different for every person. If you have bone loss, if you have gum disease and periodontitis and you have a history of bone loss, you have recession, you have furcations, which I didn't specifically talk about, string floss will not help you. It will not work. 0% effective for someone with a lot of bone loss in their mouth. You need to have an interdental brush. It's like a little bottle brush. Stick it between the teeth and spin it around. That will be effective. If you've got a bridge, if you know what a bridge is, if you have a bridge, you know what that is. These are floss threaders. It's a little flimsy plastic thing to help you get the floss under the bridge so that you are more likely to be able to get food out. But again, string floss, not super helpful. This is super floss, so it's like yarn. So part of it is like normal floss where you can get it between and then you pull it into the yarn. So it's just fatter and maybe will do a better job. And then these little floss sticks. But again, string floss, not for everybody. Water pick, excellent product, lots of research. Can get down deeper in the gums than floss. So like floss can get maybe 2-3 millimeters at best. If you've got anything bigger than that, or if you have any root exposure, a water pick, water flosser, water pick's a brand, a water flosser generically, can get like 5-6 millimeters down under the gums. And if you use it correctly, which we can do demonstrations, if you use it correctly, you're not looking in the mirror, you're doing like this lady, you're leaning over the sink. Otherwise it's all over the place. They're loud, they're messy, and they work great. So it's just another thing you have to get past. You have to like get past that initial barrier of, oh, I don't like this thing, I don't want to do it. Works great. Different types of prescription mouthwashes are available depending on the situation. Chlorhexidine is used to disinfect after surgery sometimes, or gum surgery, certain types of things. There's a thing called magic mouthwash. So if someone's got a sore in their mouth, they've got pain in their mouth, there's different combinations of these different things that we can put together. The problem is that they often, it's not something that has good shelf life. So it's usually used for an acute problem. You've got a specific problem that hurts right now. I need relief for a couple weeks for it to resolve on its own. And that's fine, but it's usually made by the pharmacist and not all pharmacies will do it. Dry mouth products, again, some dry mouth products are acidic. So even though they're solving the dry mouth symptom issue, they're not good for your teeth. So we have to balance that out. Let's see. This is just the final about pH. There's a brand called Carefree. This is the last slide. This is a brand called Carefree, who I think was invented by someone at University of the Pacific. So that's my only connection, but I don't get anything for recommending it. The website is designed to educate you about pH and your mouth and cavity risk. So their product is specifically a high pH to boost to try and get you out of an acidic state, to get you to remineralize your teeth. And the idea, the final point is the order of operations for your home care. So you wanna do your interdental brushing first, or water picking first, to clean in between the teeth and on the root surfaces. And then if you do have dry mouth or acid issues, you're gonna rinse with baking soda and water, or use some type of rinse that is gonna help boost your pH. Then brush so that your mouth is at a high pH. So when you put fluoride on your teeth from your toothpaste, it's more likely to bond to the surface of the tooth because it needs to be in a not acidic state to bond properly. If your mouth is very acidic and it doesn't matter how much fluoride you're rinsing in your mouth, it's not gonna stick. You're just gonna spit it right out and it's gonna get rinsed away and washed away. So your mouth needs to be in a more basic or alkaline state in order for the chemicals in those products to actually stick and work well. So I do make these available to people, like all this stuff. Okay, so everything here is available to you, and my email address is not on here, but I can pass it out if you have specific questions. And we got like 10 more minutes for Q&A, or longer.
Questions on Zoom too, just put it in the chat, or anyone in the audience that has a question. Okay, here we go.
She has to give you the microphone, otherwise the people on Zoom can't hear. Oh, sorry.
Hi, I have a question about water pick.
Yes.
So they're the ones that wireless,
Mhm.
and the one with the wire just you show. Are there any differences which is better or anything of the nature?
So that's a great question, and I'm going to give you, so the question was, if anybody didn't hear, was are there differences between this one that plugs into a wall and the cordless ones? There are a couple of differences that I personally have witnessed, and then there's a couple of differences that the company will promote one product or another, okay? I started with the cordless one for myself personally, and I found it to not feel as good, like it wasn't as strong. It usually doesn't have a higher setting because it's on a battery, not plugged into the wall, so the motor's not quite as strong. And the well, like how much water it can hold, is so small that you cannot get around your whole mouth with what you have to keep refilling it over and over and over again. I found that to be like very inconvenient and very annoying. The idea was I got it so I could do it in the shower. Like I told you, whoever was here at the beginning, I can't walk around and talk. I can't do it. I have to stand still and like focus on what I'm doing. I also cannot shower and water pick. So like it's just not, it's two activities that require focus and attention. I just can't do them both. Waterpik, the brand, their representatives will tell you that this model that's in this picture, this is called the Aquarius. This is their standard, highly recommended model. It's not their most expensive model. It's not their least expensive model, but this is the one that they did a lot of their research with. This tip, the clear plastic tip, it comes with like 6 different types of tips, including one that looks like a little rubber thing. Like back in the 90s, all toothbrushes had a little rubber gum stimulator at the end, right? So they made one because people have nostalgia factors, and with a little rubber tip on the end. But the water comes out at a less powerful level, so it doesn't work as much. So I use this model personally, the Waterpik Aquarius. I think it feels great. My hygienist says I'm doing a good job, so that's the one that I really strongly encourage people to get from personal experience, and also because their research is on this model. Plugged into a wall, this motor is a little bit more powerful. It does go up to 10. According to the research, level 8 is where you need to be to have the best bacteria removal from the surface of the tooth. If you go to 10, you're not going to get more removal. It's just going to go through the water faster. Does that make sense? Because it's just pushing the water out faster. So 8 is the goal on this model that goes to 10. Anything below 8 is not as good. And the main thing, aside from leaning into the sink so the water goes into the sink and not on your mirror, is that stream of water should be aiming at the tooth and not into the gums. So one thing that's extremely common is people saying, oh, it's for my gum health, so I need to blast it into my gums. It should be attached to it should be pointed at the tooth. The stream of water, the goal is to clean the tooth so that the gums that lean on the tooth are healthier. We're not cleaning the gums, we're cleaning the tooth, okay? So there are probably videos online about specific techniques, but long story short, I like this one. It's called the Aquarius, and that's what I use, and that's why. That help? Okay.
Hello, thank
Hi.
you. I have a peculiar problem going on since probably the end of July.
Mm-hmm.
I went to see my regular dentist for a prophy and an exam in early August. And I told him near 4, 5, and 6 in my palate,
Mm-hmm.
it hurts and it's swollen a little bit. He sent me to an endodontist who took 3D x-rays.
Right.
They're called x-rays. And he found my teeth are fine and he couldn't figure out what was creating the pain. I was having trouble eating even. And then I went to a periodontist
Right.
and he saw the 3D and he said his diagnosis was stress caused. And I think that that's not correct. So this morning I made an appointment for an oral surgeon, and this will be my 4th doctor. And sometimes I still have a little bit of swelling or a little bump
Mm-hmm.
for 2 or 3 days, and then it goes away. I am so perplexed and confused as to what's going. I've never had anything ongoing like this. And when I chew on something and it hits it, it's
Yeah, that sounds like something unusual, and it definitely might take more than one person's experience to come up with an answer. If it is something really unusual, certain people, like an endodontist is looking for a tooth infection, a periodontist is looking for a gum infection, an oral surgeon is going to be looking for pathology and some type of potential tumor on the surface of the tooth that's gonna, but I mean, sometimes you have to rule things out to come up to an answer. Like just from what you're telling me, there's no way I can throw out like a potential idea. It really is going to take investigation. And sometimes, like, I mean, just like with a physician, you do one test, oh, it wasn't that, we got to do another test. So I mean, don't give up. And that's a perfect thing for anything. Like, I mean, my husband has a mystery illness as well, and we've been to every kind of specialist, and it's very easy to just be like, oh, I can live with it, or oh, it's not that bad, I'll wait for it to get worse, or this or that. So I don't know what advice to give you aside from don't give up, just keep trying to find an answer until you find the answer. If the oral surgeon can't help, there are technically oral pathologists, but occlusion issues like clenching or grinding can cause pain that people mistake for endodontic pain sometimes. The swelling is like kind of throwing it off a little bit. That's
See, the CPAP and connected to oxygen, I don't think I'm a bruxer because my occlusion isn't bad. I work in dentistry, so I
Okay.
know a little bit. I have a little bit of mobility into the molars.
Mhm.
Could that be the whole cause?
So mobility can be from, so just because you don't have wear on the teeth doesn't mean, so grinding is the side to side and you get flat surfaces, right? Clenching, when your teeth like lock together and you're trying to grind, but they're like stuck together, it's gonna put a lot of pressure and damage on the gums and can cause mobility without damage to the teeth. So
Figure out it's on a grinder then if there's no telltale.
that would be one of the things, like we might recommend a night guard and see if the symptoms improve over the next couple weeks or a month or so. So if no one's made you a night guard and someone is convinced that it's an occlusion issue or a grinding or biting issue, a night guard just to see if it solves the problem or reduces the problem. You have to sometimes you have to just throw stuff at it and see what works.
That idea. Can I
Yeah.
buy something over the counter and then you do something to make it fit?
I have no personal experience with over-the-counter night guards or appliances,
Okay.
so I don't know if they're effective. Typically, something that's custom made is, I mean, that's what I was taught. My education tells me that things that are custom made, and that if you come into the office, we can adjust it to make sure it's fitting properly. I have no idea what to recommend from Amazon.
Thank you. You've
What-
been
Yeah.
very helpful. I appreciate it.
Okay,
I've
you're
just-
welcome.
A quick question here on Zoom. Someone said, is it okay to put peroxide in my water pick?
Peroxide, what did the water pick lady just tell us? In general, she recommended not to put anything but water in it. Peroxide itself, I don't know. I need to get back to you on that one. I actually know who to ask that question to, because there are do's and don'ts of putting in the water pick. The line gets clogged up like anything. So you generally don't want to put stuff in it that's gonna get in the tube and sit there. I don't know the answer. I'm so sorry.
Well, since we're at time, and I know you have a question, we're probably going to let everyone go, and then you can ask your question up with Dr. Gewelber, if that's okay, because we're right at time. So if we can just give Dr.
Yeah.
Gewelber a round of applause.
Yep.
Thank you so much for being here.
If you get that person's information, I know exactly who to ask and I can get them an answer pretty quickly.
Okay.
So. And thank you everybody for coming. I really appreciate you being here and being interested.